It has been found that bronchitis in early childhood increases the risk of pulmonary diseases at the average age, depending on the research of the University of Melbourne Allergy and Pulmonary Health. The researchers found that Australian children who had bronchitis at least once before the age of 7 were more likely to have pulmonary problems later in life. They also established that pulmonary diseases that children suffered when they reached the age of 53 were generally asthma and pneumonia, rather than chronic bronchitis or chronic obstructive pulmonary disease. The main author of an article published today in the journal BMJ Open Respiratory Research, Dr. Jennifer Perrott, said that the results came from one of the oldest surveys in the world, the Tasmanian Longitudinal Health Study, who followed 8,583 people born in Tasmania in 1961 and started school in 1968. This is the first prospective study in the very long term, which examined the relationship between the severity of infantile bronchitis with the results for the pulmonary health of adults. We have already seen that children with prolonged bacterial bronchitis present an increased risk of serious infectious pulmonary disease after 2 to 5 years. Therefore, studies like ours document the potential for symptomatic children to develop pulmonary conditions, such as changes from the function of asthma and lung, to life in mid-adult. Dr. Jennifer Perrott, principal author of a newspaper. The researchers established the link between infantile bronchitis and the problem of the adult lung by questioning the original participants when they joined the study. Participants were then followed for an average of 46 years, 42% fulfilling another questionnaire, including the pulmonary conditions diagnosed by the doctor and a clinical examination, between 2012 and 2016. By categorizing the participants in groups based on groups according to the number and duration of the episodes of bronchitis, and or loose, rattlement or cough of kite, they found that most often a participant had been diagnosed by a doctor like having pneumonia and asthma. The more the participant probably had bronchitis when he was a child. Dr. Perrott said that the figures in the most severe subgroup were low, but that the trends between the gravity of bronchitis were significant. Compared to the majority, which has never had bronchitis, there was a gradual increase in the risk of asthma and subsequent pneumonia, which most often reinforced a person suffered from child bronchitis, and especially if they had recurring episodes that were extended.